Firstly, making use of allocated funds is obviously a good precondition for achieving good health outcomes. This also implies the importance of tracking fund flows and utilization of the funds. Secondly, as GIZ Health Sector Program in Kenya, we had the very good opportunity to build on an already existing collaboration with another GIZ program in Kenya, the Promotion of Good Governance Program, commonly referred to as GOGO. Both programs were already collaborating with the Kisumu County. In addition to this, the anti-corruption project at GIZ headquarters sparked the specific collaboration on good financial governance in the health sector. In particular, it addresses 4 areas. Firstly, strengthening planning and budgeting processes. Secondly, ensuring public participation in management of health services. Thirdly, strengthening complaint mechanisms. And lastly, increasing awareness on rights to health and patients' rights. To mention just 2 challenges, there are funds flow challenges. Normally, funding is supposed to flow from the national government to the county government and from the county government to the hospital level. If we take the example of free maternity services funding, the funds are supposed to come from the national government to the hospitals. However, our experience on the ground is that some facilities complain that they do not receive their reimbursements on time, and sometimes the reimbursements are insufficient and not regular. There is also the issue of public participation. The Constitution of Kenya provides for public participation in issues of governance, both at the national and county level. This is, however, not happening effectively. There are instances when people are called to meetings, they either do not understand their role or they do not understand the content sufficiently, and therefore their participation is not very effective. To give just a few examples, GIZ is training civil society organizations on carrying out funds tracking surveys. In the example of free maternity services, they are empowered to carry out the tracking survey to analyze how the funds flow from the national level to the hospital level. They are also empowered to analyze how these funds are utilized at the hospital level and therefore the impact that the funds are having on the quality of services delivered. Secondly, we are building the capacity of civil society organizations and community through community health workers to carry out social audits at the hospital level. Social audit is an important tool as it enhances citizen-led accountability mechanisms for service delivery. Thirdly, we are building capacity of hospital boards. Hospital boards membership is drawn from the community and they are mandated to carry out oversight on management of the hospitals. By building their capacity, they are then better able to carry out this mandate and provide strategic direction to the hospitals. Lastly, we are strengthening complaints mechanisms structures at the county level. Here we work closely with senior county officials. We sensitize them on existing legal framework and constitutional requirements on handling complaints. They're then able to come up with very strong structures that are responsive to the complaints from the community. As far as Kisumu is concerned, the county sees a lot of value in this initiative and fully supports it. Indeed, at the request of the Minister for Health in Kisumu, a tripartite task force on good governance in health has been formed. This task force comprises senior officials from Kisumu County and representatives from the 2 GIZ programs, Health Sector Program and Good Governance Program. We are therefore convinced that the county will be able to carry on this initiative. From the experiences we have gained in Kisumu, we expect that Kisumu is very well placed to scale up this initiative into other counties in Kenya.